Assalamu alaikum. On behalf of Ahsan Academy, let me welcome you to a series of presentations on head neck region. This is the first presentation. The presentation objective is to have an idea on the extension of the head neck region, the distribution of the fascia in the neck region, and distribution of the deep fascia a bit detailed, and finally we'll see the compartment, how the neck compartments are made. The neck lies above a line. If we draw it joining some features like jugular nose, you can identify here in this red marked area, then we can follow the clavicle to the lateral end. If we see from the back, we can see the vertebral prominence. This is the spine of the seventh cervical vertebra. Then if we connect these two parts, the lateral end of the clavicle and this prominence, this total line is the lower limit of the neck. Then if we draw a line across the base of the mandible up to the angle of the mandible, then we can identify the tip of the mastoid process and we can connect these two. And finally, you see, if we see back, we'll get the external occipital protuberance. This protuberance is marked here as a red round line, and then the line is following the superior nuchal line of the occipital bone. So this is the line that indicates the upper limit of the neck. So above this line is the head. The head region has the face and scalp, then the cranial cavity within the within the skull, then two ears, two orbits containing the vital eyes, and two nasal cavities that's making one organ, that is the nose, one oral cavity, and finally some foci. So all this together making this head region, and each of them should be studied separately as the gross anatomy content. The neck, how we should study? We should study the skin and fascia, then bones and the muscle, then viscera present here, and the blood vessels, nerves, and the lymphatics. In this sequence, we can study the neck separately and the head separately. Let's start with the neck. The neck skin has some important features. In the anterior midline features are most important. You see, we can easily identify the laryngeal prominence. In English, we used to say it is Adam's apple. So easily you can see, and more prominent in the male. This is indicated by the arrow. It is the laryngeal prominence. Just above it, there is a notch. This is the notch in the thyroid cartilage. So the thyroid notch is just above the laryngeal prominence. If we follow the midline, the laryngeal prominence, the thyroid cartilage will gradually slope down, and then we'll get a soft part, and after that we'll get a soft tissue swelling. This is isthmus of the thyroid gland, and this is indicated in the other figure by diagram. Above this, the cartilaginous structure is cricoid cartilage, and you see this between this cricoid cartilage and the thyroid cartilage, there is a soft area. This is cricothyroid membrane, and at the bottom of the neck we'll get the jugular notch. So these surface features easily can be identified on the body, human body. Sometimes you see the isthmus of the thyroid gland has pyramidal lobe that extends up, and we often need to have a hole in the larynx or in the trachea to place a tube for artificial ventilation or opening the obstructed airway. So this part is clinically significant, and this anatomical structure should be remembered while doing this procedure. Let me show serially the structure in the anterior part of the midline. So this is the uppermost area, contains a bone, that is the hyoid bone. Below the hyoid bone there is a soft membrane. This is known as thyrohyoid membrane, and this extends into the Adam's apple as the thyroid notch. This thyroid prominence is known as laryngeal prominence, and below that we'll get cricothyroid membrane, and below that is the cartilaginous ring, is the cricoid cartilage. After that we'll get relatively a softer area, that is the isthmus of the thyroid gland, and between isthmus of the thyroid gland upper part and the cricoid cartilage the first tracheal ring can be palpated, and below the isthmus will up to the jugular nose we will get the trachea, and the tracheal rings are palpable. This is anatomically important, that the anterior part is triangular in nature, that accepts this. You can see the structures that run between the thorax and the head. This follow this triangle, and on the either side the posterior triangle. This is actually uh, allowing the passage of the structure that run between limbs, necks, and thorax. Let us start with the fascia of the neck region, the cervical fascia. It is as usual comprising of the superficial fascia and the deep fascia. Superficial fascia comprises of loose connective tissue, and one special thing is that it contains fat as well as a thin muscle that is known as platysma. It lies between the skin and the deep fascia. This is the platysma shown in the figure, and we can see the deep fascia distribution. And the deep fascia is subdivided into three types of sheets, and one by one each should be studied separately. This platysma is a very thin muscle that we can see in the figure, can corrugate the skin below the mandible and above the mandible, and this is having attachment to the base of the mandible, and this is the bony attachment. It goes above this, and you say it is attached to the skin of the cheek and lower lip, the angle of the mouth, and the circular muscle around the oral cavity or lips. This is the orbicularis oris. So this is fused with that, so contraction can corrugate the skin of the face. Below it is going down, and it is attached to the skin and the supraclavicular as well as infraclavicular lesion. So this can corrugate even the skin of the chest, anterior wall of the chest. Deep fascia is very important clinically, so the gross anatomy of this should be studied a bit detailed. This is, if you cut the section, you'll find this type, and diagrammatically different colors are used to show different layers of the deep fascia. The outermost layer is the investing layer. Around the vertebra, this is prevertebral layer. Around the viscera, it is pretracheal, and lastly the carotid sheath on either side. So we can indicate it by the arrow. This is investing layer, this one is the prevertebral layer, this is visceral layer or pretracheal layer, and carotid sheath. So one by one let us discuss each of the layers. Naturally, first the layer is investing layer. It is the outermost layer. Here it is indicated by light green color, and this you see surrounding the whole neck as stockings. It's a total enclosing sheath, and this from posteriorly it is attached uh, to the spine of the cervical vertebra and extends upward and below. This is attached superiorly and inferiorly with the bones that I will discuss in the next slide. It is enclosing the trapezius muscle, muscles, sternocleidomastoid muscle, and infrahyoid muscles, as indicated in the figure cross section of the neck. Superiorly, we have discussed as the limit of the neck above is the place of attachment of the investing layer of the deep fascia superiorly. This is the occipital protuberance, and a line is showing the superior nuchal line. Then you can see the mastoid process, and it is attached to this area, and if we follow anteriorly we'll get the base of the mandible, that is the lower border of the mandible up to the chin. So this is the line of attachment of investing layer of the deep fascia of neck superiorly. If we look below this jugular notch of the manubrium sterni, then on either side we'll get the clavicle. So this fascia is fused to these two areas, and let us go back, we'll find this vertebral prominence, it is fused here, but in between these two it is continue below and is attached to the spine of the scapula. You can see that this is the area. It is extending up to the posterior surface of the thorax to the spine of the scapula. Prevertebral layer. This is deep to the investing layer, and it surrounds the, it's a cylindrical that surrounds the vertebral column as well as the muscle associated to the vertebral column. A shaded color is showing the area. So this contains the scalene muscles and other muscles here within. It extends, it carries the structure from the neck to the axilla, or from to the axilla and then upper limb, and also from the upper limb structures are going back. This is in a canal, and this prevertebral fascia extends as a canal around this structure, and it is known as this axillary sheath. You can see in the figure the axillary sheath and its structures. So prevertebral layer continues into the axilla as a tunnel, and this is anatomically important, that carries some clinical significance. Prevertebral layer, if we follow the orange color arrow on the right side of the cross section of the neck, is showing this prevertebral, and this is extending anteriorly, and the red arrow is showing here it splits into two. The black arrow is showing the two layers. So this splits anteriorly into two layers, and longitudinal fascial space is enclosed in between these two layers. This arrow is indicating, and the two layers are shown in this figure. These are the two layers of prevertebral part of the deep fascia. So this is containing the loose connective tissue, and if you follow it on the right side, you can see that this space is going up to the thorax. So it is continuous from the base of the skull to the thorax. So anything accumulates here will go to the thorax without any obstacles. Pretracheal fascia, the other name is visceral fascia, and I'll prefer to indicate it as visceral fascia. This is the anterior part of the visceral fascia, and this is posterior part of the visceral fascia. Many times we together, this fascia are also known as pretracheal fascia. This surrounds the trachea, esophagus, and thyroid gland. So it is better to say as visceral fascia because this anterior part is specifically known as pretracheal fascia and the posterior part is known as buccopharyngeal fascia. So in summary, you can say this is visceral fascia that encloses trachea, esophagus, and the thyroid gland, the anterior part of which is pretracheal fascia and the posterior part is buccopharyngeal fascia. Here you can see the pretracheal fascia that is enclosing the viscera anteriorly, and it is shown by the black arrow in the cross section of the figure. You see this on the left figure is indicated by sky blue color and it is attached to the hyoid bone. Then it is going down to the thyroid cartilage and going down further to split and enclose the thyroid gland, and then it goes to fuse with the fascia of the soft tissue of the thorax. So now you can imagine that if the hyoid bone moves, then this will carry the thyroid cartilage as well as thyroid gland above. And when it returns back to its normal position, the thyroid gland will go back to its normal position. So the thyroid gland moves with deglutition. This is the reason behind this. You can see in the figure the posterior layer on the right side cross section showing the layer of the visceral fascia that lies behind the pharynx and esophagus. This is extending from the base of the skull and below going to the thorax. So this is known as buccopharyngeal fascia, and this buccopharyngeal fascia superiorly attached to the base of the skull and inferiorly it is going to the thorax to be fused with the soft tissue of the mediastinum. Now the last one is the carotid sheath. It's a column of fascia that surrounds the carotid artery and nearby structures. So it encloses the common carotid arteries, then internal carotid artery, internal jugular vein, and the vagus nerve. Now, the fascial spaces are very important clinically because this has continuation into the thorax, and these spaces are very close to some organs and structures. You can see the space behind the buccopharyngeal membrane is retropharyngeal space, and there is another vertical space that is in between the anterior part of the prevertebral fascia. This space that lies in front of the trachea and also by the side of the thyroid gland is also continuous with the thorax. Let me show serially. These are the viscera. So it is enclosed by one type of cervical fascia. This is vertebra. So in front of the vertebra, the two layers of the prevertebral fascia encloses one space, and this is the buccopharyngeal fascia. This is having one space behind. This is known as retro, means behind pharyngeal space, and there is two space between two layers of the prevertebra. This is black shade is shown, and prevertebral space means it is just in front of the vertebra and the longitudinal ligament. Let us go for the summary. Outer part is the skin, then we'll get the superficial fascia which contains platysma. It's a very thin muscle. After that we'll get the investing layer. If you follow, you'll find that anteriorly the investing layer splits to include sternocleidomastoid muscle, and posteriorly it is enclosing the trapezius muscle. It is attached posteriorly to the spines of the vertebra. Now it is prevertebral fascia that is also attached to the spine and extends anteriorly. Then it rotates laterally and goes at the front by the side of the vertebra. Then it splits into two, the posterior layer and the anterior layer. In between, there is a closed space extending from the base of the skull down to the thorax. This is the area you can see with the green shade. It's the space between two vertebrae. The visceral layer in front of anterior part that encloses the thyroid gland and trachea. This is pretracheal fascia and it is component part of the visceral layer. The dotted line indicating the buccopharyngeal membrane. This is the posterior covering of those organs. The space behind the buccopharyngeal membrane or layer is retropharyngeal space. So you can see retropharyngeal space between two layers of the prevertebral fascia are two important spaces. The anterior layer of this prevertebral fascia that lies in front of the vertebra, this is also known as alar fascia, and the space behind it in front of the posterior layer is alar space. This is also known as danger space. You can see all the spaces lying behind the pharynx and esophagus, going to the thorax, extending from the base of the skull. I'm taking photographs of this, enlarging actually the square area. You can see this different fascia. This is the anterior layer of the prevertebral fascia. This is also known as alar fascia, and the behind one known as prevertebral fascia proper. And the anterior to it is the buccopharyngeal layer. So this space between the alar fascia and the prevertebral layer of the fascia is the danger area, and between alar fascia and the buccopharyngeal layer, this is part of the visceral fascia, is known as retropharyngeal space. Here it is indicated by danger space by DS, and RPS is the retropharyngeal space. The danger space extends from the base of the skull to the posterior mediastinum, and it is in front of the vertebra. This contains loose connective tissue, and this is a very rapid route for the spread of the infection of any time to the posterior mediastinum. You can see two X-rays. The left one is the normal and the right one is having some problem. You can see the blackish shadow, deeper shadow is the nasopharynx, then oropharynx, then it is continuing in below. It is the alimentary tract part. On the left side it is close to the vertebral column, but right side figure showing a much separation. This is the red line indicating that the soft area is not normal. You can see the arrow is indicating this pus formation. This is spreading to the thorax. So it is going down and already posterior mediastinum is involved. You can see it is in the danger space and it is indicated by the anterior margin of the vertebra already eroded. So this is in the danger space and it is extending into the posterior mediastinum. The normal one is a narrow cavity, narrow space. Here the danger space is shown. That is the space is here dilated in diagram also. The deep fascia divides the neck into several compartments. You say this is cylindrically this divides the neck. If we go for the outer part, this is the outer compartment which encloses the muscles. Then is the visceral compartment, contains the viscera, means the trachea, esophagus and the thyroid gland. Then you can see the prevertebral fascia encloses the muscles and the vertebra around it. Then neurovascular compartment, it is the carotid sheath that encloses the nerves, artery, and the large veins of the neck. This is paired, but others are unpaired. Thank you very much for remaining with me in this presentation.